Yeah, the federal legislation was passed in 1965 that enacted Medicare and Medicaid. So for the last 40 years, we've not had a major redesign in the Medicaid program. In Louisiana, we continue to spend large amounts of money, but we also get 49th place in our health outcomes. So this redesign is intended to increase the level of health outcomes, improve health for all those that are enrolled in the Medicaid program, and also do it by containing costs.
And we understand the redesign is called BAYOU Health. Explain what that means.
BAYOU Health is the name of the program. Underneath BAYOU Health, there are 5 different health plans which will be taking care of Medicaid enrollees. In this case, what we might call managed care is very much like employer-sponsored health insurance, where individuals have one plan and they work with a set of providers in that network. For example, in Louisiana, the 5 plans that we have to choose from all offer a variety of benefits that might focus on areas like chronic condition management, so helping children with asthma or children and adults with diabetes. They might focus on prenatal care for women to get better birth outcomes. Those are the value adds in this project that we don't have access to in the traditional Medicaid program.
How many people in Louisiana are on Medicaid?
Total, we have 1.2 million people in the Medicaid program today. In BAYOU Health, we'll have about 865,000 people enrolling. These are primarily pregnant women, children, and some disabled populations. All will have the benefits of coordinated care, incentives, health coaching, and chronic condition management in the program.
How is the transition going so far?
We couldn't have asked for a better transition. Launching yesterday, all of our systems and networks are in place. We're working very closely with patients, physicians, hospitals. There are many questions that are coming up as we go along, and we have answers to about every one of them. So this has been one of the smoothest launches of Medicaid managed care in the entire country.
Now, what will people see that are on Medicaid? What changes will they see? Initially,
they'll see material from their health plan. If they're enrolled in any one of the 5, they'll begin to have a relationship to understand what hospitals, what specialists, how to get, say, health coaching or chronic condition management. On a first couple of weeks basis, there will be no change in the doctors that they see, the hospitals that they go to, if they have been approved for care already in the old Medicaid program. Once they develop the relationship with the new health plan and have a primary care physician, that they can begin to have a deeper relationship, something that they can build on, whether it's around well child visits, asthma care, if it's a pregnancy, to have the benefits of a health plan, again, in that coaching, in the ability to help manage their health or their chronic disease. That's when the relationship begins to blossom. Remember, so much of the emphasis here is on wellness, on prevention, and on managing health and chronic disease, instead of going to the emergency department as your last place to go for primary care, or only going for hospitalizations when there's been no ability to manage a disease or a condition on the way in.
It seems like it's a move toward more individual care for the Medicaid recipient.
Yeah, it provides benefits that we didn't have before. It coordinates all the care that's available in a far more efficient way. We end up saving money in the process because we're keeping people healthier and we're treating them in far more efficient manners.
What kind of response have you had from Medicaid recipients themselves?
Yeah, we beat the national average by far in terms of the number of Medicaid enrollees that actively made a decision and entered into BAYOU Health by choosing a health plan. We continue to get a lot of questions about what does it mean for me, how do I access benefits, how can I make this work for me? And we've spent a lot of time on education for enrollees. For hospitals, hospital administrators, and physicians, we continue to work with our provider groups. We're introducing a new way of running the Medicaid program, so it's our responsibility to make sure that we effectively educate our stakeholders and our business partners, which hospitals and physicians are.
And we understand that you've set up a hotline room.
Yeah, we have our rapid response center here at DHH. Thankfully, it's not been very busy over the last 2 days, but we have been doing for the last month daily conference calls with the provider community to answer questions as we go along. We are effectively using our web properties so that we're able to post questions and answers for providers and enrollees that have questions. And we've made several hotlines available at any time for providers and individuals to call in if they have questions on ways to navigate or access the benefits of BAYOU Health.
What changes will a typical doctor see when he or she sees a Medicaid patient?
Yeah, what's great is their relationship will start out with the health plan. Traditionally, when the relationship was between just DHH and the physician, we had a rate, they provided service, we paid. Now they're in programs which provide all kinds of support for their enrollees that are in Medicaid. In fact, there are some plans that have relationships where there could be bonus payments for physicians by just keeping the patients more healthy, which the old way of doing business is that physicians and hospitals only made money when people were sick and had problems and had to get more services. Now we shift some of the incentives so that it becomes fruitful for everyone to keep people healthier or manage a condition rather than having to seek more expensive healthcare services.
What's your goal for this program? Where would you like to be a year or 2 years from now?
Well, the ultimate goal is to have Louisiana #1 on the health rankings. In a year or two from now, we want to move out of 49th place. We want to move out of the bottom decile. We want our programs to produce higher quality, more obtainable healthcare services. At the same time, we need to arrest the cost increases. We need to bend the cost curve and make it more affordable for the taxpayers of our state.
What's the timetable for the entire state moving to the BAYOU Health program?
In 120 days from now, the entire state will be enrolled in the plan, and we'll continue as we move forward working with Medicaid enrollees. As new people come onto Medicaid, they'll have choices. The health plans will continue to refine their networks of providers and specialists and hospitals. And as we move over time, we'll be reporting out data on quality and outcomes so that the people of our state can see how effective this program is being.
Are you encouraged by the results so far?
I've been holding my breath until yesterday, and once we launched, I've been looking at all the feedback and the results, and I am extremely pleased about how well things are going. This so far has the markings of a very successful program.
If people have questions or like more information, what should they do?
Well, first of all, go to the website at BAYOUHealth.com, and they can call either of the two hotlines that we have set up to get more information about the program or to inquire how to access benefits within the program.